Okay, we have more joining us, but we'd like to get started. We have a lot to cover today. Thank you so much for joining us today. My name is Melissa Devlin. I'm the Assistant Director at the Grand Families and Kinship Support Network at Generations United. And you have joined us today for our webinar on Across the Map, Around the Table. We are featuring 6 Family Resource Center models that are lifting up kin caregivers and grandfamilies. And we are co-hosting this webinar along with the National Family Support Network, which is one of the network's subject matter experts. Next slide, please. Okay, let's just do a quick overview of what we're going to cover today. We're going to give you a brief background about the Grand Families and Kinship Support Network. We're going to do the same for the National Family Support Network. We are going to meet all of our Family Resource Center representatives here today and have like a fireside discussion panel conversation with these programs that are doing amazing work to support grand families and kinship families across the nation through family resource centers and wrap it up. And then from there, we are actually going to switch over to um, a Zoom meeting format to have a little bit more of an informal Q&A discussion. And we will be putting the Zoom link the Zoom link in the chat at the end of the session. And hope you can all join us for our Q&A time. I know that we have a number of people joining us here today with Family Resource Center, so we're excited to introduce you to the Grand Families and Kinship Support Network and vice versa. I know we have a number of people joining us today with Family Resource Centers. I'm sorry, with Kinship Navigator programs and Kinship Serving programs that would like to learn more about opportunities to partner with Family Resource Centers. So, just a little brief information about the Grand Families and Kinship Support Network. Here is some main areas of ways that we are serving organizations, tribes, and states and systems across the country that are serving kinship families. We are the first ever National Technical Assistance Center on Grand Families and Kinship Families, and we are funded through a cooperative agreement from the Administration for Community Living, which is on the aging side of the federal government. And we are working in these major categories to be able to provide free technical assistance and supports to organizations such as yours. So some of the main things that we're doing is providing learning collaboratives and information sharing, such as through webinars to talk about the different ways that we are serving kinship families across the country. We have a website, which my colleague will put into the chat, and you'll see it there below too. It's the only really centralized hub for a variety of resources on that you can use in serving grand families and kinship families. We have about over 100 unique, newly created resources on all sorts of different topics that intersect with kinship. So please take a look. That's always being updated. And then we also provide individual technical assistance. It's all free of charge. So if you need help from anything from developing a firewall policy to developing a kinship support group to something a little bit more in depth, we are here to help you. And if you look at our chat, you can see how you can request assistance with us. We are also supporting a 2-year effort called Bridging Systems for Kinship Families in 3 jurisdictions across the country. And our goal there is to help those jurisdictions promote cross-system collaboration. You see in our little umbrella all the different systems that intersect with kinship families. And oftentimes we hear from families that these systems are siloed, makes it very inefficient, frustrating, and prevents access to needed services by caregivers. And so a lot of the work that we're doing across the network is really trying to promote cross-system collaboration so that the experiences are better and more effective for these families. And I believe here today we're going to talk about kind of an intersection between kinship navigation and family resource center. So this is another way that cross-system collaboration is really working well to help families around the country. Next slide, please. And then in partnership with the National Family Support Network, we have a number of resources that really talk about different ways in which family resource centers are providing supports and services for grandfamilies and kinship families. And one thing I do want to specifically point out is the one on the left, which is Kinship Matters to Family Resource Centers. If you are working with the Family Resource Center and you really want to be able to explain why kinship is important, that's a really great tool to use. And then we have some more in-depth tools here that are featuring ways in which family resource centers are partnering with other organizations to serve kinship families. So look in the chat for links to those. We will also be sending out these slides, which will include links to all the resources so you can catch up on that later. Next slide, please. And then this is our newest resource. Many, many thanks to National Family Support Network for interviewing the programs that are here with us today and really getting to the meat and potatoes of really what's working in these programs to help support kinship families. So we'll be hearing from all of these programs today, but also for a little bit of a deeper dive into their programming and more about how they're serving the families. You can take a look at these individual summaries. This is hot off the press, and I love it because there's just so many different ways that these families are being served, and we'll talk about that more today. And now I will turn it over to my colleague, Brenda McChesney, who's co-director of the National Family Support Network.
Thank you so much, Melissa, for that framing and for your partnership in this work. So building on what you shared, I wanted to take a quick moment to introduce the National Family Support Network and provide a brief overview of family resource centers. So to start, to give you a sense of the national landscape and the reach, we started this small but mighty initiative back in 2011 with 8 states coming together who had membership organizations serving family resource centers. And at that time, we decided that there was enough of a critical mass to make a national movement to support family resource centers and families from across the country. And over the last 15 years, we've quadrupled in size, and we now have 40 member networks, which represent 39 states plus the District of Columbia that serve more than 3,000 families. 3,000 family resource centers are included in that, serving more than 2 million people annually each year. And our newest members to join were Missouri in June of last year and New Mexico, who joined this year. Next slide. Our mission at the NFSN is to promote positive outcomes for all children, families, and communities by leveraging the collective impact of state family resource center networks and championing quality family support and strengthening practices. And our vision is simply that all families have access to quality family support services in their communities, provided by family resource centers and supported by strong family resource center networks. We have 3 core areas of work. The first is connecting and convening members, and we can go ahead and switch the slide deck, please. We connect and convene members to enhance their overall effectiveness. We promote family support best practices and evaluation by raising awareness of what quality family support looks like, as well as promoting shared common language and standards and evaluation metrics and tools. And this is all done through the implementation of our standards of quality for family strengthening and support. And the third area is around raising the visibility and the value and the impact of family strengthening and support networks. Next slide. So just a little bit of background on family resource centers themselves. In case that you are not familiar with them, a family resource center is a community or school-based welcoming hub of support, services, and opportunities that are designed to be supports for families so that they can be strong and successful. They may be community-based, like the image on the left, which is from a family resource center in Vermont, or they may be school-based, like the image on the right that you see from an FRC in Kentucky. Next slide. They also may be in rural settings, like the image you see on the left from Colorado, or in urban settings, like the image you see on the right, a family resource center in Bronx in New York City. And family resource centers are a community or school-based hub that connects families with those supports and services. And key pieces about the definition of FRCs, which was put into statutory language just over a year ago, is that they're multi-generational, strength-based, and family-centered. So they're really about supporting children and adults while building on family strengths. They're also responsive to community needs and interests by shaping the voice and the priorities of the families that they serve. And accessibility, providing supports at no or low costs to ensure that all families can participate. And last, community building is at its roots, which foster peer support and social connections that build protective factors and reduce isolation and stress for families. Important here is that they're designed for all families, not only low-income or highly challenged families, so that the support that's received is non-stigmatized and it makes it more readily accessible for all. This next image is a conveniently sort of located hubs is where FRCs either bundle services, co-locate services, provide these, or have very warm handoffs to other practitioners. And so here you'll see examples like home visitation program, evidence-based parenting education, health screening, play groups, kinship programs, fatherhood programs, family counseling, and food banks are just a handful of some of the core activities that FRCs do. And on the next slide, you'll see that in 2016, Robert Wood Johnson helped to fund a research initiative to identify the most naturally occurring activities at FRCs. And these top four were the highest activities done by all FRCs across the country, which include parenting support. And you'll see it's a continuum from lighter touch, like a parenting workshop, to more intensive services, which would be perhaps like a home-based parenting education program, evidence-based. Also, access to resources. Quick introductions. So from Arizona, we have Janelle Rodatio joining us, who's the Division Director for the Family and Community Services at Lutheran Social Services of the Southwest. We have Mari Ramos from Idaho, the Executive Director of the Idaho Hispanic Community Resource Center. From Kentucky, we have Carrie Tackett, who is the coordinator of the Galantine County Family Resource Center. And we have Sheila Lichty from Louisiana, who is the Family Resource Center Administrative Director, Education and Treatment Counselor at Council FRC. And from New Jersey, we have Heather Sarcini, the Program Coordinator of the Highlands Family Success Center, as well as China Anthem, who is the Kinship Grandparent, Kinship Navigator Program in New Jersey. And for Virginia, we also have two representatives. We have Chris Robinson, who's the chair of Connections Family Resource Center, and Shambe Fuller, who is the Kinship Grandparent and Connections Family Resource Center representative. So thank you all for being here today and for doing the work that you are in your communities. I'd love to start by grounding us in your work and giving everyone a sense of who you are and the communities you serve and how kinship and grand family support fits within your broader Family Resource Center model. So we'll start with the first question. It's just to simply introduce your organization and describe the context of your kinship and grand families work within the broader FRC services field. And I'll start with Arizona with Janelle. So mic's to you, Janelle.
Thank you. Good morning, everyone, or afternoon, depending on where you are in the country. As Brenda said, my name is Janelle Rodosha, and I am the Division Director for Family and Community Services with Lutheran Social Services of the Southwest here in Arizona. We are a faith-based organization and have family resource centers that are located on church campuses and on a school campus. And it's just really, as she said, what a family resource center is where families come for support, resources, and connections. Over the last couple of years, we have been fully integrating our work with our foster division into our family resource centers and really putting a focus on our kinship work and supporting grandparents, relative caregivers, and fictive kin who are stepping in often unexpectedly into caregiving. And in our family resource centers, families can access basic needs, parent support, coaching, and peer connection. Because we're co-located and co-integrated with our foster care, we connect kinship caregivers with resources to reduce social isolation. And really, one of the focuses that we have is decrease levels of toxic stress for caregivers and the children to increase equitable outcomes. Our goal is to strengthen families and honor the role of the caregivers that they are already playing. Thank you.
Thank you so much, Janelle. Appreciate you giving an overview context of the work in Arizona and at your FRC. Up next, we'll turn it on over to New Jersey.
Hi, everyone. I'm Heather Saraceni, and I am the program coordinator at the Highlands Family Success Center. Again, as discussed, we're a strength-based family-centered program, and we focus on building meaningful relationships and empowering families within our community. Our foundation is rooted mainly in what sometimes can feel like a transactional service where people come in, receive services, and then leave. But we're really transforming that into something that's more inclusive, relational, and engaging, making our relationships with the community much, much more transformational and giving caregivers and families and youth a voice. So we're always looking for ways to expand our programs. So a big part of that came from our collaboration with the Kinship Navigator program, and really listening to the needs of our community. One of our core values is that we don't do programs for families, we do them with the families. So with that mindset shift, it kind of allowed everything to just flow. Families now feel ownership, connection, and trust in the services that they're receiving. And we try to be very intentional in making our space feel very welcoming when they come in. It doesn't feel like an office. We really feel like a home. We have a coffee station and a snack station as soon as you walk in the door. So as soon as you come in, we're always going to offer you something just to make you feel, welcome and not worried about everything that's going on in your life. We recognize that kin caregivers are a very important part of our community. So this was a wonderful collaboration to make with the Kinship Navigator program. And because of that, we knew that we couldn't just offer services here. We needed to meet the kinship caregivers where they were. So instead of just having those services within the Family Success Center, we collaborated with the Kinship Navigator program and Care Plus to actually go out to their location as well. Accessibility is very hard where we are. Everyone thinks New Jersey thinks that, everything's easily accessible, but our center is up in the middle of the woods and we're in the middle of nowhere. So all families aren't able to come here. So whether it's due to transportation, work schedules, other barriers, there is no public transportation really much in this area. So like I said, we go to Care Plus, we do the programs there, we meet the families in the community, we do social engagements in the community, we've gone to the movies, and we just kind of try to take the travel to them so that they, alleviate one more stress in their life. I'd say kinship work isn't necessarily different from what we do, and it's fully integrated into our mission of strengthening families. It's more now about being inclusive with the families. We actually have a kinship caregiver as a member of our parent advisory board, so that's great. The family's very active within our FSC. So that's something that we love to see. And then I think just building the connection with the kinship navigation program just expanded that as well.
Thank you, Heather. I really appreciate the theme of your work is with families, not for families. And it's exemplified by your example of showing up where they're at in the communities, realizing transportation barriers are a very real barrier to access. So thanks so much for hiding that piece.
Thank you.
We'll turn it over to Kentucky now to give a little bit of context into the work that you're doing at your FRC, Carrie.
Hello, everybody. I'm Carrie Tackett. I am the Gallatin County Family Resource Center coordinator here in Warsaw, Kentucky. We are a school-based program. We serve children birth to grade 5 in our small rural community. We are one of the smallest counties within Kentucky, but we have a large amount of families who are kinship. 25% or more of our families from kindergarten to grade 5 have someone other than their biological parent raising them. Within our program, we offer so much to every family. We are a connection to other services within the community. We offer our Grand Love program, which we're going to talk more about today, which that program empowers our grandparents and our relatives raising relatives to live their best lives. And we also offer them just concrete supports in times of need. So we serve about 750 children from preschool to grade 5 and their families. And we feel that we're relationship builders. We really want to build the relationships with our community and with our families and build that trust and help empower them to reach out and be with each other and just try to get them to live the best lives they possibly can live.
Thank you so much, Carrie. I appreciate you giving us that context. And Louisiana, Sheila will have you share next.
Hi, I am Sheila Lichty with Educational and Treatment Council Family Resource Center in Lake Charles, which is in Southwest Louisiana. ETC Family Resource Center has been serving Southwest Louisiana for over 25 years, serving primarily the families involved with the Louisiana Department of Children and Family Services. And in 2020, there was a huge shift in the state to look at placing, look at relatives for placement instead of automatically putting them into the foster care system. And so since the resource centers around the state were kind of on board with this, that became a huge go-to. Our strategy started with when a referral would come in for a family to take parenting or whatever other needs that were met, we would automatically look to see where those children were placed. If the children were placed with a relative, family member, fictive kin, or somebody like that, we automatically would reach out to them and start talking to them about what it was like to have the children with them, what their needs were, how we could support them, because we believe in supporting the families with compassion, empathy, and kindness. Like definitely helping them make sure they have what they need, not getting in their business, not trying to figure out what is it that you need as far as because you know the agency is involved, but more of this is your family. We want to help make sure that you can take care of those kiddos. So now our strategy has become, besides continuing to do that, we are completely open to the public. And in 2022, the huge push was for a community outreach and navigation. So we are there looking at senior centers and anything in the community resource fairs, think baby showers, the things that we can be part of so that we can let them know that there's services out there. The biggest questions we usually have are do I qualify for anything, or what is there out there that I can do without it being like I don't really want to have my kids or my grandkids or whoever. So we're really excited to be part of this and how successful it is here in our little old corner of the state.
I appreciate that you started to share a bit about the community collaborations that you've done in Louisiana. It was one of the things that really stood out around the success of your program, and look forward to hearing more about that piece. But for now, we'll turn it on over to Virginia. We have both Chris and Shambay here representing Virginia.
Hi, welcome everybody. And I'd like to thank you on behalf of our team. And I've got Shambay Fuller here, who's a Lex leader and a kin caregiver who can speak a little bit later about some of the work that she's done and how she's kind of paying it forward to help others in her situation. We're a mobile family resource center. We serve out of Manassas City in the Prince William County, Virginia. So this is a Northern Virginia type area. We're a volunteer-based program, so we have 0 staff and a lot of interested people who want to try and help out, and families that want to try and help out each other. It spun out of our local Rotary groups and a whole dozen nonprofits or so that wanted to help out in the community and partner together to figure out how to make connections to do that. And it's part of Virginia's Family Forward organization's Thriving Families Save Our Children initiative. So this is how we kind of our base. Demographically, we serve a really diverse population. Prince William County is, I think, in the top 10 in the country in diversity. Very heavily Hispanic area where we are, with affordable housing units and trailer parks. Just picture those next to $1 million townhomes that are popping up left and right. So you've got all those areas of just great need next to like incredible wealth. Most of the families that we encounter face huge barriers, whether it's language, trust, lack of transportation, affordability of housing is off the charts, skills and education development, and basically just straight on struggling to survive. It is expensive out here, and most of the families are feeling that pain day in, day out. We use a mobile RV approach to bring resources directly to those communities. So we can drop a community center into a trailer park, for example, bring in all sorts of different partners, make it fun and festive, invite people out of their homes, go grab some food, play some soccer with us, sit out in some camping chairs, get to know each other, and learn where to get resource support and help. So we try to make it a fun, festive kind of approach as we think about how we engage. And most of the families that we encounter are literally unaware of a lot of the potential resource support that they can get. And many don't trust the system, who feel like they've been burned by the system in the past. So they're kind of gun shy going back in. So that's your typical scenario. And I think for the subset of families that we meet with kinship care, it's just one more layer on top of a very complex situation. So it's not that they just need a kinship care program. They need help with all those other things, whether it's mental health support and with the kids and everything else. So I know you guys are all dealing with very similar situations, but it's a wonderful opportunity to try to reach into the community and meet people for the first time who can get some resource help and support. I'll stop there. Thanks so much.
Thank you so much, Chris. I appreciate you sharing the landscape in Virginia and within your community, and looking forward to having you share more about the development of the mobile FRC and the ways that it does wraparound services to communities and across counties where you live. Now we'll turn it on over to Mari in Idaho.
Okay. Well, we at the Idaho Hispanic Foundation are really proud to provide what we call whole person support in the community, along with providing a fully bilingual, cultural focused family resource center that serves primarily the Hispanic Latino families. We also serve many families that are also could be considered mixed status families. Our kinship work is embedded in our broader services. We provide things like case management, food access, health clinics and health navigation, workforce and business starting support. And but we also recognize that our caregivers, especially our kin caregivers in our Latino community, they don't really identify as being part of a program or even being a provider. Many of them are just doing what comes naturally and don't know, aren't aware, or sometimes are scared of seeking out services or support. What they're doing is just really providing care for a loved one when it was needed. We are seeing a growing number of grandparents, aunts, older siblings, fictive kin stepping in due to economic instability, family crises, but increasingly now a lot due to immigration-related disruptions in our community and in their families. And our role is really to meet them where they're at with trust, with language access, with culturally relevant support. But we really try to meet them and let them lead what they need, but also giving them a broader picture of what is available so that they know the questions to ask or they know where to go from there. So I'll leave it with that.
Thank you, Mari. I think from what you just shared, one of the pieces that really stood out is that many of your families who are doing kin caregiving are just doing what comes naturally because they just care for the loved ones that are in their family. And I think that was one of the common threads when we did the interviews with all of you, is just the heart of the community that you serve and that them wanting to do best by their loved ones. So I appreciate everyone setting the context in this space and helping paint a picture of what your local FRC efforts look like and your approaches to kinship and grand family engagement. That brings us into our second question. And what's powerful here is that while each of your models looks a little bit different, there's really clearly intentional strategies behind how you're supporting families. So I want to dig into that just a little bit more. Our second question is really in the space of innovation and impact. And so we'd love for each of you to answer what's one standout strategy, practice, or partnership that your FRC uses to support kin caregivers and grand families, and what impact has that had? So we'll start at the top again with Arizona.
Thank you, Brenda. So, in one thing that really stands out for us is that we center caregiver voice and really want to hear from them directly. And a lot of times when nonprofits and we want to hear from people, we send out surveys and things like that. We chose a different approach in trying to really go to them And one of the things that we are doing is dinner with the director. So once a month, I ask our foster care specialists who are meeting and the case managers with the families. They will nominate some kinship families to come to dinner. And so we share a meal, and then most importantly, we listen. We listen to what's happening, and then we can use that information and that feedback to directly shape our programs. And one other thing that I'd like to share about is our Grand Connection series. We I think it was 2020, started using the 0 to 3 Grand Connections curriculum with our grand families. We have added one more workshop to it and use the protective factors introduction series, because the grand families really wanted to understand protective factors more. So really, again, listening to what they're doing and giving them a space for education and peer support. The impact engagement goes up, isolation goes down, and trust grows. Most importantly, our services reflect what families actually need.
Thank you, Janelle. I see in the chat somebody mentioned, but just put in a dinner with the families to hear from them. What a great idea. Love the dinner with the directors. That's something that stands out, especially because in our field, we really value feedback and 360-degree feedback loops and want to do surveys and assessments and understand how we can improve. But often that approach can feel cold. And the idea of having a warm meal and a warm gathering to authentically listen and respond and hold space, I can imagine how transformative that is and the relationships that you have that you're building at your center. So thank you, Janelle. We'll now turn on over to New Jersey. We have Heather and China joining us from New Jersey. So why don't you tell us a little bit about what one standout strategy, practice, or partnership that your FRC is using to engage kin caregivers and grandfamilies?
Thank you. I'm going to speak very quickly, and then I'll let Ms. China chime in a little bit as well. I also love the dinner with the directors and kind of going that route to get feedback. So for us, we started with a enhancement pilot. So we started with a pilot program to run the parent cafes for kinship caregivers. During the enhancement pilot, the Department of Children and Families created a data team where the providers gave them feedback. And with that feedback, we're now in the part of the program where we're enhancing the programs. So it's taking their words and shaping it and expanding the program moving forward. So when you run a parent cafe, it's very structured, but we would like to make them more transformational so that we offer not just a program and it's checking the boxes, but more reflecting what the family's needs are, what their experiences are, and what the caregivers want. So again, they also asked for the protective factors and how we're going to expand that. So we have ways to expand that moving forward. And then our collaboration with the New Jersey Kinship Navigator program, that's where China is a part of. So through that partnership, we were able to build strong ongoing relationships. We offered, the open communication. We shared our goals. We were able to break down barriers. It's not really about working smarter. No, it's really about working smarter, not harder. Recognizing that when programs collaborate, you can get more done. So you don't need to redo everything to make the outcomes significant. You literally just collaborate, bring your resources together and strengthen programs. We're very mindful about creating the welcome space here, but also when we go out, we want people out in the community to feel just as comfortable as they were if they were to come to our program in the center. Sometimes it doesn't always work that way because you have to work things out, but I would say that with the collaboration, our programming is very meaningful and sustainable. And caregivers have said during the surveys that they feel like they're not going through this alone. They're now supported by us, by the other programs as well. Ms. China, would you like to say anything on?
Yes, well, I've been with the kinship program since my granddaughter was like 15 months old. She got put into the system from my daughter, And I met Paul Cates then, and he told me about the Kinship program. And they've helped me a lot getting things done, um, so she wouldn't have to go into foster care. So I was able to take care of her. And I've come across people in and out of court, and I told them about the Kinship program and how they've helped me. And a couple of people did go into it, that I kept in touch with. But what I like about them is they're not judgmental. They're there to really help us. We meet, we meet other parents, grandparents, aunts, uncles, and it's just mind blowing. I'm going to be 80 years old. My granddaughter is 14. I've had her since she was 3. But when I reach out to my worker, she's there. And I've had workers in the past, they've always kept in touch. If I call them for something or asked a question, they were there. They never tried to brush me off or I'll get back to you or anything like that. So I'm blessed. I see children today that are going through the system. I talked to someone the other day. She's having a really hard time. She has 3 boys. And I told her to reach out, to the caregivers program to see how they can help her. She's in therapy, and it's a lot going on out here. And I'm truly blessed. I have an older daughter that helps me as well. But one thing I wanted to say is I was in the foster care system helping children to get back with their parents. And I ended up adopting 3 foster children, a set of twins and their baby sister. And that was a lot, and I didn't know that I was supposed to get money every month or whatever, but I didn't care about the money. I was trying to get the children back with their parents, and that didn't work. So for me, caregivers, I love them. Any way I can support or help or do, I will.
China, thank you so much for being a shining example of an advocate in your community, of an amazing grand family raising a grandchild, and also the essence of, the ripple effect that happens when you're touched by services like this and sharing it with everyone that you know. So thank you for being here and thank you for sharing. We'll
Thank you.
now open it up to Kentucky. We'd love to hear a little bit about the space of impact and innovation that in your work.
Okay, with our grand families, we have a program called Grand Love because it takes great love to raise a kiddo that's not your own. We meet once a month during the school year with just the caregivers. They wanted a space where they could come and just be together. At first, we really tried to bring them things that we thought they would want, but they just wanted to be together and they wanted a space where they could be themselves again and not be grandma, mom, aunt to these wonderful children that they're raising. We have lunch together. We talk. We pray together. We do a series through the family, through the UK Extension Service called Crafting Calm. Our crew loves to craft. So we do tons of crafting things with them, and they just sit around and we paint or diamond art and do things, and we just talk about what's going on in our lives. We love connecting them with other caregivers as well. We have a wonderful family who is a foster family that started coming to our program, and they were raising their last foster kid in the high school 2 years ago, and they have raised over 300 foster children alone. And they are great support and wonderful, wonderful example for our families who just sometimes wonder how they're going to get by. And when their last foster kiddo graduated, they came to me and said, "Do we have to stop coming now?" And I'm like, "No, we're a family. We love you all. We want you here. We couldn't do it without you." So their names are Ron and Debbie Hardy, and they are just amazing people. And they have raised like double-digit kids of their own and then 300 others. So they come with a wealth of knowledge and support for our families. And then another great thing we do a nighttime meeting every other month roughly so that all the families can come together. And we cook according to the, I'm trying to say it right, Plan, Eat, Move curriculum through the UK program, the University of Kentucky. And we teach them, they're very picky eaters, and we try to get them to try new things. And we all cook together and we all have a meal together. And then once a year, we take them on an outing because our families, we're a very rural community. They don't get to do big things very often. They just don't have the funds to do that. And we take them to the local minor league ballpark in Florence, Kentucky, and let them have a grand families night out. Do it on Firework Fridays because they get to see fireworks. And this year we're even going to try to provide them with a meal. So it's just a fun time to be together, and we consider ourselves a big family, and we help each other.
Between the sacred spaces that you give them to connect just with them, to share and learn and process, and the way you engage them, the Grand Love title seems so absolutely perfect and apropos for the work that you're doing in your community. So thank you, Carrie, for sharing that. Would love to turn it on over to Sheila in Louisiana to share a little bit about the impact and innovation of your program.
So here in Louisiana, we were given some marching orders that said, okay, go into your whole region and make sure that that you offer the services everywhere. And we are again in our region very rural, and I have 5 parishes or counties for y'all. Had to come up with something different, something unique. We can't go purchase property in every parish. We can't, I don't have enough staff to be there all the time. What are we going to do? What are we going to do? And the families need us. So what we came up with was we call it our FRC Mobile Day. And so we basically pack a vehicle full of enough whatever it is that we need for the day. And we have we go to a specific place, like in one parish it's a church, and in another parish it's the health unit, in another parish it's a city building. And we're there all day. We put out our sign, ETC is here today, and we meet everybody. If they need a parenting class, if they need car seat safety, if they need safe sleep, whatever it is that they need, they come to us. We go out in teams, so somebody's at the assigned FRC day, and then others could go into the homes where, sometimes we have to go meet people in their homes because they have no transportation to come to us. While we started this, we built our kinship program into it, knowing that we had just as many kinship families in these areas as we do the families needing other resources. So we cross-train our staff so that we can have whatever we need. We may have a family come where the parent needs parenting. The children are placed with a relative, so the relative brings the children. They all get the parenting at the same time, or depending on the need of the families, we may have something for the relative caregiver in another room, something for the bio parent in a different room, and here we're meeting the needs of all of the family at one time. Our biggest thing is also that we're not excluding anyone that's not an actual biological relative. Our big thing in Louisiana is we do fictive kin. Godparents are huge in Louisiana. Everybody has an Aunt Mary, right? Like, you don't know where she came from, but Aunt Mary is at Christmas, Aunt Mary is at Thanksgiving, and you even know Aunt Mary's birthday, but you don't know where she came from. Like, that's us in Louisiana. Everybody has an Aunt Mary. That's what's called a fictive kin. That is that person that is going to be there. And you know what? If in the role of a child, that is a relative caregiver, and that is a safe person for their family of origin if they were to be taken or placed other than their biological parents. It's very important to have those.
Thank you, Sheila. One note here, if you haven't picked up on it, is that we have at least 3 of the 6 FRCs who have some version of what could be considered mobile or satellite work that they do. In New Jersey, that's the satellite by having cross-community collaborations and having almost like FRC pop-ups, if you will, with other agencies and communities to bring the services in a satellite way in extension. We also have the example of Virginia, who will go next, of a you haven't seen the image of it, but it's a beautiful 40-foot wrapped RV that they take out into the community. Like everybody sees this like just gorgeous structure coming in to pull in to bring services to people all throughout their community. And in Sheila's example, is they take their mobile efforts in a vehicle, a two-person vehicle that they take out, and they go to different communities on a regular cadence to have that mobile outreach effort having there. And it speaks to the creative, adaptive ways that we need to think about iterating our programs to be able to reach to the folks that are most in need of us, that we want to connect with the families in our community. So thank you three for highlighting just very unique differences of how you do that approach. So now with Virginia in mind, I'm teeing it up back to you. Would love to hear on what you think is some of the work of the innovation and the impact that you're doing in Virginia that others could learn from and possibly implement.
Okay, thank you. First, I want to say that I'm raising my granddaughter who's 5 years old. She's a child with special needs, and I've had her since she was born. So I just want to start off with that because the relatable factor plays a big role, I feel like. So every individual family is unique and one of a kind. Therefore, the strategy changes based upon the family's immediate needs or concerns. Examples being referrals needed, or perhaps just basic information and or instructions how to apply for specific benefits or programs. Connections being a mobile unit allows us to meet families exactly where they are, literally. Um, being to sit in one's own home at their kitchen table, drinking a cup of coffee, allowing the mom to cry and vent and share stories. It's all surreal. And it's like looking into the mirror. It's me. We share the same stories. We share the same concerns. And again, I think the relatable factor plays such a big part. And then it allows the families to feel supported, heard, comforted, advocated for. Um, and the impact is not only phenomenal, but it's never ending. And I never see like an ending to it. And to be at an event and so many different things going on. Like Chris said, we've got food, there's music. We've partnered with other organizations. It's all these, fill up a bag of clothes for, and holding up to the baby to see if it fits. And it's almost like looking at a sigh of relief. Because you know that she's meeting a need in that moment. That's phenomenal. It's phenomenal, and that's never ending. And I feel like that's one of our many superpowers at Connections. That's what I have.
Thank you, Shambe. Chris, did you
You're
have
welcome.
anything to add on to what she
I
shared?
can't top Shambe's experience there.
One thing that Shambe did not say, and Shambe, hopefully you're okay with me sharing this, but one of the most magical stories when you think about how the work of family resource centers can connect with families and communities and from them really listen and respond. Shambe was the brainchild behind creating a mobile outreach unit that she said, listen, we have to go to where families are needing only after receiving services for herself and her granddaughter.
So what we do is we are creating a naturally supportive, but also fun and culturally engaging environment. We do a lot of similar things to other organizations that are on this call, fun nights, but we do like loteria nights, which is very cultural, mercaditos and yoga and things like that that are familiar with our culture. And we're building this community through these peer groups where caregivers are sharing their experiences. They're also taking the lead in what they are good at, or where they can provide. A lot of people don't want to just feel like they're takers. They want to be able to provide. They always want to be able to provide. And when we empower them to be able to do that based on what they do well and what they can naturally do, it creates that supportive environment that takes that fear and that stigma away. And one of the other great things is that we partner a lot with other immigrant serving organizations. We partner a lot with schools, with natural trusted community leaders that are already there. It's the vecina, the neighbor that everybody goes to with their questions, that maybe she doesn't have a formal title, but she's already a natural leader in her environment, maybe at her workplace or with really her friends that she knew, partner a lot with them to create those trusted systems and that trusted place where people can really engage. And this creates such an increased stability for those children because they don't only have this kin provider, right, that doesn't even see themselves as a kin provider, but they also have all of these other people who have now surrounded them and have now cared for them, and that they can also trust within the system, right, that they don't even know that they're in. So it's just creating this strong ecosystem that could feel inaccessible, but making it accessible and trusting and just a natural support for them.
Thank you, Mari. One of the pieces that stands out in what you shared is just the way that you're able to connect the legal needs and supports of the community that you serve, but first by creating a space within cultural context to build that trusted relationship. As part of this work with Generations United, the Kinship and Grandfamilies Network, we did a national survey of family resource centers who serve kinship and grandfamilies and asked what are their highest needs of resources, and legal needs ranked in the top like 80% of everyone needing to understand how to navigate it, how to connect them to it. And you've not only cracked the code in the how to go about the actual resource navigation, but creating the space, because we know like when there are issues that tie to legal issues, it's more vulnerability, like for the human who needs it, especially in this current climate and context. And so to broker the two together is a beautiful way to make sure families are getting what they need and in the way that they need it. So thank you so much. Oh, I love this conversation. I'm sad that we're already to our last question, but indeed, we only have about 12 more minutes to dive into the very last question that we have for everyone. So I just want to take a moment to take the learning one step further. And the last question that we have for you is really related to your advice to the field. And we'd love for you to share what's one lesson learned or recommendation that you'd offer to other programs looking to start or expand kinship programming. And going in sequence, we'll start with Arizona again first. Janelle. Oh, Janelle, you are muted.
Okay. So I think thank you, Brenda, and this has just been a joy to listen to everybody's stories. And our advice to anyone is you don't have to start from scratch. Look at what you're already doing and how you can integrate kinship support into it. One of the questions that I learned early on in this work was ask where caregivers are already showing up. Where do they pay? Where do they play? And where do they pray? And so go to those places. Second, listen first and then design second. Really, what do families will tell you what they need. And finally, start small. One group, one conversation can really build momentum. You don't have to start with, solving the problem for everyone. Just start small. Center dignity and belonging, and work will grow. Kinship caregivers are already doing the hard work of keeping families together. Our role is really to show up, listen, and build systems that honor and support them. And if we want to truly strengthen families, it starts with listening and building alongside them, not for them.
Thank you, Janelle. I need to go back to your 3 Ps because I caught 2 of them and it was very catchy. You said they need a play, we go where they play, pray, and
pay.
Pay. I like pay for services, like where they're showing up to receive.
Mhm.
Okay, excellent. That's a really nice shorthand to think about where do we go to meet the communities that we're looking to serve. So thank you so much.
Exactly.
Appreciate that. New Jersey, what final thoughts and advice to the field do you have?
I would say that you have to build relationships with everybody. Build a relationship where they feel heard, where they feel trusted. Um, Show up just not in a professional manner. Show up as a person. I think when they realize that they're just talking to someone else, it just opens up a whole other world where they feel comfortable. So I myself grew up in a kinship home. We had my two cousins with us from when we were really little. There was always a million people in and out of my house. It never dawned on me until halfway through our second meeting that like I lived through it. I understood it. And then when I shared that with them, they were all like, wow. So being personal and being able to connect with them in any way, I just feel like that gives everyone a sense of calm and a sense of being able to discuss things, openly with everyone. So it's a space where they don't have to have it all together. We don't have to have it all together. They could just come in and share their story and be themselves. And I think when they have that true connection, that's where any healing can begin, any conversation can begin. Um, I think it's all built intentionally, and when you're consistent and honest and have those genuine relationships with the kinship families, they're open, and it expands it so much. I would say to bring that everywhere you go, not just within this work, with everything that you do. So anytime someone comes through those doors, lead with authenticity, break down those barriers, and just be there for them.
Thank you, Heather. China, do you have any additional thoughts on the question of recommendations to the field? Oh, China, you're on mute.
I'm sorry. Heather was just saying that people was always in and out of our house, and I just thought about that. We always had children in and out of our house, but I thought they were cousins or relatives or whatever. But everybody trusted my grandmother, and they would bring their children. They would stay all week. Some of them would never leave. And I didn't realize until I got really into junior high school that they were not related. My grandmother was always helping. And my aunts say to me until this day, the three that are still alive, you are just like your grandmother. You're always taking people's children in. You're always helping people. You're always running here. You're always running there. And when I think about it, we've done it all our lives. We never asked questions. We just helped. That's what we did.
That's beautiful. It's a true shining example of the heart of family support work, really showing up in that way of vulnerability and authenticity and transparency. And ultimately, we're asking the families that we work with to show up in the same way. And that can be met so much quicker when we, as professionals in the space, show up with that same, not as a title, but as a human who wants to connect with another human. Thank you for sharing that piece, both China and Heather. Now we'll switch it on over to Kentucky. Would love to hear your thoughts, Carrie.
I agree with everything that was said so far. And one thing I would empower you all to do is not be afraid to change it up. We tried for years to have a grand families program, and it just wasn't successful until we listened to what they wanted. We tried to have it at the school. They didn't want to come into the school because that was a place that was like all business to them. They wanted something a little softer. So we had it at our extension office. And then we tried really hard to give them things that we thought they needed. But when we listened to what they needed and what they wanted, that's when our program really just took off. And like everybody else said, it's just loving the families and coming to them to where they are and then just building on their strengths. And we have one of our Grand Love families that says it the best, said, if you get them there once and you make them feel loved and appreciated, they'll keep coming back. And that's what we try to do. Like I said before, we're a family and we truly do love each other for who we are and who they are. And just got to build those relationships and let them know that they've got people.
Thank you, Carrie. I appreciate it. And especially the willingness to dare to try to change things up, to dare to dream differently and not be afraid to fail because you're getting closer to finding what's right in your attempts of trying to get there. Thank you. Louisiana, Sheila, what advice do you have for folks?
Well, again, and I love everything. This is such an awesome fireside chat. I wish that it was a little bit where you could ask a whole lot more questions and really get into some of the stuff we're already doing. What I would say is the first thing is we definitely had to meet them where they are, literally going to them, especially in our rural area. I mean, hence the mobile FRC day. The other thing is being so proactive as far as being part of the community, being part of those local resource fairs, baby showers, whatever's going on. Who would have thought you could have pulled kinship grand families in at a baby shower? You would think of those as all the new moms. You would be surprised at the number of people that were there because they actually just got their grandbaby or their baby niece or something like that because that we're unable to go home with the mom. So don't think that any of those things that are out there, use the partners that are already in the community. And that also will help the funding because whereas some things are so limited, if we use the things that are already in place and we partner together and we build those capacities with our churches and our even businesses, you would be surprised at the number of businesses that says, "Hey, I want to be part of that." So use what we have and expand your lens. Like don't disclude anybody. It will work.
Thank you, Sheila. And Shabay and Chris, advice from Virginia. What do you have for us?
Well, I think Carrie stole my thunder on some things, but I want to echo that because it's so true. My advice for you guys, innovate like crazy. I'm not a social services background person. I'm a business guy, and in the business world, you've got to constantly be innovating and trying new things and testing what works and testing what doesn't. I think we're no different, right? We have so many challenges, so there's not enough staffing and funding to meet demand. In our Virginia, there's not enough money in our state to solve the housing crisis. So we're going to have to figure out how to help families, solve these things. And doing it the same old way isn't going to do it. So my thought is to be wildly entrepreneurial to solve problems. Don't be afraid to try to pilot those models, create wins for partners. When you create wins for your partners, that creates wins for the families, and utilize their expertise and go out there and figure out how to use new technologies like AI to help teach families to fish for themselves. Where we are, very few families have a computer, almost none. But nearly everybody has a phone. And with a phone, you have from the right prompts to something free like Claude. Any family today has the entire world of potential resource support at their fingertips, personalized to themselves. How can we help them with that, utilizing this type of things that everybody else has these capabilities to do? And if we teach them to fish and they see a benefit, they can spread the word to all the other families and friends in their community and scale at a level that we could never possibly do as a small FRC unit. So just, one person telling 10 friends that they trust and their church group can get a massive impact, and everybody's resources can go a lot further. So be wildly entrepreneurial to support your families, get them involved in the solutions to fuel their hope and provide that pathway to self-sufficiency. And like in the case of Shanbei, they'll blow you away. Some of the things that she's done in developing programs, she can turn something around in 5 minutes that used to take a month. But she's figured out how to do it now, and it's just amazing to see. So that was my quick thought. Thank you, guys.
Thank you, Chris. The theme of entrepreneurialism, innovate to ignite change. I love that. Mari, you're bringing us home. What is it? What do you and Idaho have to share with the rest of the folks on the call today around lessons learned and takeaways?
Great advice today, but I think I'm going to start with building trust, and creating that trust, and language access is also so very important for many families, especially immigrant families. Fear and stigma are the biggest barriers, and if you don't create intentionally culturally safe spaces, they will not come, or even if they come, they will not open up. So recognize that immigration and legal complexity is deeply tied to kinship care. Even if your program isn't immigration focused or immigrant or culturally focused, recognize that does create a lot of kinship families. So build firm relationships. Other community leaders, promotoras de salud, which are community health navigators, other peer voices, they're the most effective forms of outreach. So yeah, that would be my advice.
Thank you so much, Mari. And really what we've heard today, it reinforces that there is no single model nor single mode to operate kinship and grandfamily engagement in, but there are some key principles that make this work effective that were highlighted by all of you today. Centering relationships and trust, elevating lived experience, meeting families where they are, and building supports that are responsive to real community needs. I know I feel deeply encouraged that all of these approaches can be adapted and applied in communities across the country, regardless of who your primary audience is. And this is how we continue to grow the field, by learning from each other and carrying these insights forward. With that, I just want to thank all of you one last time for your time and your passion and your commitment to this project. I hope the viewers read your 2-page spotlights, and excited to turn it back over to Melissa to wrap us up and guide us into the Q&A section of our time together today.
Wonderful. Thank you so much. Oh my gosh, what such great ideas. So much there. Thank you all for presenting. We are going to actually move into a Q&A session in just a moment. We do have some questions that have come in, and also want to be able to see if others haven't had a chance yet. We are going to move over to a Zoom meeting format so that we can have a more interactive conversation, and just keep an eye out on the chat in just a moment for the link to that. But before we leave, I want to just say if everyone can just take a moment to complete our poll. It's just a couple of quick questions about how you felt the webinar went, and feedback for us and for our presenters, and anything else that you might be interested in learning about through our webinar series. Okay, in the meantime, as you are filling that out, I do want to let everyone know that we have a webinar coming up on April 8th. Family resilience, not resistance, family resilience in Black kinship care, perspectives of children, caregivers, and birth parents. And that'll be presented by Dr. Teresa Washington. Really great data and interpretation of that. So please join us. You can scan the QR code here. We will also, in our follow-up email, send you a link to that as well. And then please reach out to us if you need assistance. Everything that we offer is free of charge. And if we can loop in our National Family Support Network subject matter expert into helping, we will do that as well. But please reach out for help. And we will see you over at the Q&A session. Thank you all so much for joining us here today.